Hi, this is Travis Barker. Going to provide a brief presentation on the downtown east side second generation health system strategy. This health system strategy is documented in a 42-page report authored by Vancouver Coastal Health in collaboration with service providers, clients, and stakeholders in the downtown east side community. One of the things to consider when reviewing this report is one of the opening phrases by the Chief Operating Officer at VCH, and so emphasizing the language in this particular phrase. So while building integration into the fabric of services that have traditionally operated in silos, this budget-neutral downtown east side second generation health system strategy will better serve clients by improving and building on the many programs and services that are already working. So the intention of the report is to identify goals, strategies, and intended outcomes to improve upon existing services already being reserved. So there's a recognition that there's a lot of great work being accomplished in the downtown east side, but also key in this particular phrase is the budget neutral reference. So the intention is to realign the use of resources and efforts in the downtown east side, but not necessarily with increasing the overall budget in some areas where there's intention for services to be expanded. The report implies that funding to expand in that area would be utilized from other areas. So it's just kind of clarifying what areas are going to have the most impact on the downtown east side. So the table of contents here, just for this presentation, intending to kind of break this discussion into kind of three areas. So that's just a review of the downtown east side second generation strategies. So what are the goal domains? What are the 5 goal areas that are being emphasized by the report? Followed by additional strategies, review the strategies that are also being delivered in those goal domains, and what are the outcomes that these strategies are intended to help us achieve. And identifying outcomes is particularly important because throughout the implementation of this health system strategy, we'll be evaluating these outcomes to determine whether or not our efforts are really achieving what's desired. And then this discussion will try to wrap up with a few proposals regarding how to conceptualize this larger 42-page report and how to implement some of the strategies across the programs and services and throughout the downtown east side with the different organizations and states. So on this page, attempted to just emphasize the overarching framework for the report. So the 5 specific domain areas that are being emphasized. So that includes strengthening our relationships, followed by extending care teams and competencies, integrate services to provide better coordinated care, aligning services with client demand, and achieving performance excellence. Within each domain, if you're looking at the graph on the right-hand side of the page, you'll see that there are additional strategies that are intended to help organizations to align their efforts across the downtown east side to perform in these domain areas. And we'll be reviewing some of those strategies in the next sections. On this slide, just providing a review of the outcomes. These outcomes are actually shared throughout the report. So what you'll see here is that some are actually mentioned many times. So if you look at the center of this slide, some outcomes that are particularly being emphasized includes client-reported quality of life and overall health improvement. And there are a few other outcomes that are clearly being prioritized as well. So one suggestion for when implementing the health system strategy is that organizations have an opportunity to have a greater impact in the beginning if they consider beginning their discussions within the organization and across organizations, emphasizing some of these outcomes that are clearly being prioritized the most. That way the strategies that are being rolled out in the beginning will begin to have an impact across some multiple goal domains at the same time. And then as time moves forward, can begin to roll out some of the other additional strategies to make sure that the rest of the recommendations are being carried out.